Okay, well, in the essence of time, we're going to move forward with things, and first, one thing I do want to do is recognize the Chamber's annual partners for the year. We're fortunate that we have a number of companies that have elected to support the Chamber in a comprehensive manner, and so certainly want to make sure that we continue to recognize them for their support of the Chamber, whether that be in a physical realm or if that's virtual as we are here. And so certainly, again, want to recognize and thank them for their continued support over the course of the year. And with that, I'm going to now introduce our panelists that we have with us. And so first is Matt Anderson. And Matt is a partner with McFarland Insurance Agency in Columbia. He is a graduate of Howard County Public Schools and Towson University. He started at McFarland in 2010 after 4 years with Selective Insurance Company. He works with business owners and individuals in and around Howard County, protecting their assets, employees while managing their cost of risk. In addition to being active with the Howard County Chamber, Matt has had roles with the Howard Tech Council, has served on numerous nonprofit boards, and is an active patron of Howard County breweries, distilleries, and restaurants. And certainly they need his support now. He resides in Ellicott City with his wife and 2 young daughters. And so Matt Anderson. Next, we're waiting on Russell Berger, who's I think has been held up a bit, but I'm going to still introduce Russell. And Russell is with Offutt Kerman and is an accomplished labor and employment attorney and their department chair. He provides business counsel to employers on employee matters and is well versed in litigating in both state and federal courts. Russell is the trusted legal counsel every business owner needs to feel confident in their decision-making and secure with their assets. As a practice group director at Offutt Kerman, Mr. Berger has direct experience with managing other managers, which he draws from in advising his clients. He is a pragmatic problem solver that works efficiently and tirelessly to present his clients the best possible solutions to their most complicated issues. And he represents employers, businesses, and professionals in employment disputes across the nation. And my pleasure to introduce to you Russell Berger.
Thanks, Leonardo. Next. Happy to be here today.
Thank you. Thank you. Excuse me 1 second. Let's see if that. And next is Kelly Hall. And Kelly has been a Howard County resident for over 20 years. She began her career with Giant Foods while she was still a student at Long Beach High School. Throughout the years, she has been promoted to positions of increasing responsibility with the opportunity to manage store operations in every Howard County food location. She attended Howard Community College and continued her education to receive professional certifications in human resources management and workforce management and development from Michigan State University. Today, she is a human resource business partner supporting a district of 18 stores and their teams, providing strategic direction and guidance in labor relations, recruitment, retention, training and development, and association engagement. Recently, Kelly has been acknowledged by several professional organizations, including the Griffin Report's Top 40 Professionals Under 40 and Progressive Grocery, Top Women in Grocery. She is affiliated with the Network of Executive Women Mid-Atlantic Region and serves on the steering committee as recording secretary and networking connections co-chair. She is often found on the campus of Howard Community College, reviewing resumes, conducting mock interviews with students through her association with the Network of Executive Women. And she currently serves as the recording secretary for Mayfield Woods Middle School PTA. And in her spare time, if it seems like if she has any, she can be found on the baseball field cheering for her son, Jacob, who plays with the Elkridge Youth Organization and traveling with her husband, James. So Kelly, thank you as well.
Hello.
And lastly, but certainly not least, is Deborah Stallings. And Deborah is the president and CEO of HR New, a multi-million-dollar company headquartered here in Maryland. Her company assists employers to attract, hire, inspire, retain, and empower high-performing talent. In the 20 years since she has founded the company, HR New has generated millions in revenue and employed hundreds. HR New is a full-service human resource management and equal opportunity firm at its best, and the company boasts an impressive client list including federal government, local municipalities, the private sector, as well as nonprofit clients and their employees. She's a lifelong learner dedicated to the pursuits of knowledge and has earned degrees, the Master's of Arts in Management and Leadership and a Bachelor of Arts, Business Administration from Notre Dame of Maryland University. She also served as an adjunct faculty member in the School of Business at her alma mater. She is a certified professional by the National Society of Human Resource Management and certified senior professional in human resources by the National Human Resource Certification Institution. Deborah Stallings has demonstrable commitment to corporate responsibility, and it's evident through her activities as a community leader. And so again, that is our panel that we have assembled with us today. And so again, we're gonna now head right into our discussion. And really, I've got some questions prepared for them, but also I'm going to ask, again, those of you that are watching, certainly if you have questions of them as well, feel free to send those also. And so the first question that I'm going to ask really is for everyone. And that is, so, and actually maybe just to stop here, I'm going to provide a little bit of backdrop again for today. And so as we touched on it, we're talking about liability issues in the workplace, largely as a result of COVID-19. And so, for instance, the U.S. Chamber said last week, we saw nearly 200 new COVID-19 lawsuits involving businesses. The number of new complaints increased in almost all of the categories that they've been tracking, most notably in the insurance coverage realm. And so there have been multiple lawsuits claiming exposure to COVID-19 and inadequate protective measures were filed. There were also new suits related to the Paycheck Protection Program, which we will certainly talk about in a different arena, but insurance coverage disputes and employment discrimination. There's also been a growth in lawsuits related to challenging stay-at-home and business closure orders. Also, so with that, we're going to transition into yesterday here, Governor Hogan came out with the latest executive order and ultimately allowing businesses throughout Maryland to begin to open up and ultimately leaving a lot of decisions to county executives across the state, particularly. But with that, and the announcement from Governor Hogan, starting perhaps with Deborah, and again, I'm going to ask everyone the same question. What perhaps, from your perspective, are some basic tenets that businesses should be doing at this moment, just based upon things that maybe they've read on their own or the governor's announcement, and as they really start thinking about having employers physically come back into the workplace?
So good afternoon, and thank you, Leonardo, for the opportunity to participate on this distinguished panel. So some of the recommendations that we've been talking with employers about have to do with really just preparing to have employees return to the workplace. So that means everything from looking at your policies and procedures. It's a good time to look at things associated with anything related to the Americans with Disabilities Act, discrimination, age discrimination, pregnancy, what protective equipment is needed for your staff, et cetera. So those are some key things to look at. And one of the areas to focus on is really keeping track of what different agencies and municipalities are saying about what you need to do before bringing people back to work. So that's, agencies like the Equal Employment Opportunity Commission, the U.S. Department of Labor, OSHA, in terms of health and wellness, CDC, federal guidelines, state, local directives as well. And also talking with your workers' comp insurance providers and general employer liability insurance providers to understand what's going to be covered, what's not covered, and what standard operating procedures, policies, processes, et cetera, you should have in place to protect your employees as well as protect your business. So those are some of the initial things I think that's important to look at, looking at, what is a potential direct threat, as well as, those high-risk workers, and ensuring that you have a good plan and process for how you're bringing people back. So we're encouraging employers not to rush into this process, to really think it through, to establish a good plan, and ensure that you've considered these kinds of things and have a checklist prepared that allows you to bring people back in a safe and caring way. And also, as part of this process, I think it's important to have a communications plan and an orientation and onboarding process, so that you are bringing employees back and ensuring that they understand what your company's revised or new policies and procedures are as it relates to these matters, because this is a new normal. We're learning as we go, and we want to do everything that we can as business owners, leaders, executives, managers, supervisors, to ensure safety and also to ensure that the business can continue to be a viable and reliable concern.
Excellent. So next, Kelly, if you would take that same question. And again, that
Sure.
just to and I was gonna say, just to repeat it, just what are maybe some basic things that businesses should be doing at this moment?
So I think it's very important that you write your plan. It's similar to what we would see in the food industry as a food safety plan or a HACCP plan, writing out exactly what steps that you're going to take to protect your customers and your employees. Everything from, providing PPE to providing, touchless or contactless service if you're serving a customer. And making sure that you even walk through what you would do if you do get a positive case, from one of your employees, or if if a customer comes in and reports that they tested positive as well. And then how you're going to, store all that data, record all that data so that you can provide it easily and reference it easily, and your employees know where to find it.
And Matt?
I agree. Obviously, having a plan and clearly communicating that plan to your employees is definitely important as things continue to slowly open up, but also stress that there needs to be some flexibility within that plan. One of the metaphors I've heard thrown around a lot in the midst of this is we're building the airplane while we're trying to fly it. And that goes with every business and every business's unique exposures with this, because you could have the best plan in the world, but let's say, the spouse of one of your key employees, gets sick. And now that key employee needs to, self-isolate or else risk, infecting the rest of your staff. So be flexible and be able to kind of think on the fly and adapt as these new exposures keep getting thrown our way.
And lastly, Russell.
Yeah, obviously, I agree with pretty much everything that's been said. I would just note that on the plan or a policy, I think it makes sense to have a written employee policy that you can give to employees that explain how you're going to deal with COVID-19. And just like a handbook or any other form you would give an employee, it makes sense to have acknowledgement of that. And that's a way to mitigate your risk to some extent. Obviously, you need to actually have good plans and follow through on them to fully mitigate that. And one other thought that I had, just kind of high level at this stage, is you also want to consider kind of your you can have an employee plan that you hand to employees, but you also want to consider all the back end things that you wouldn't necessarily put in a plan that you would promulgate to employees, but that you would keep. You, like some of the other panelists have said, you want to be prepared for the questions that are going to come. So, for example, if you're doing screening at the door, if you're making guests fill out a questionnaire or survey when they come to your office or your place of work, how are you storing that information? If it's medical information, are you compliant in terms of keeping that confidential? those are kind of back end things that you should be thinking about as well.
And Russell, we're going to actually stay on something that you just mentioned, and I was interested enough going to ask Kelly this as well, and that is, I guess maybe I guess there are two parts to this. There's certainly that which the business has as it pertains to their employees, and then there's that piece for businesses that pertains to the customer. And I guess maybe from a legal perspective, what is it that a business can maybe ask or not ask a customer as they come in terms of trying to maybe ascertain where they may have been or where they haven't been? And so that's kind of the first place. And obviously, Kelly, in your instance, being with a truly public facing, company that people come from all over. But I guess, Russell, just legally, what can businesses actually ask, or maybe what can they not ask?
Well, with respect to customers, you can ask, where they've been, have they been to any hotspots? And, that's kind of, the whole country could be considered a hotspot at this point. So some of those questions are maybe not that useful, but you are permitted to ask customers if they're exhibiting symptoms. You can do temperature scans. And, there's a big difference, and I'm interested to hear what Kelly has to say, because there's a very big difference between an open retail establishment like a grocery store and an office space where maybe you have guests come in, clients come in, or someone to deliver the mail. That's a lot different than just being open and having the general public come in all the time.
So, Kelly, how have you guys managed to try to handle that delicate situation?
From a customer-facing standpoint, we don't directly ask them any questions. We encourage, the social distancing. In our stores, we make announcements every few minutes explaining the use of face masks, one-way aisle traffic, and then, of course, using the plexiglass, and even doing postings like please don't step around the plexiglass, stand in front of it. I've seen some stores where there's X's on the floors saying where to stand to protect both the customer and the employee.
And so staying, I guess, maybe with you particularly on this, something we talked about, prior to today was also related to vendor management and maybe trying to control access. And so, while many of us may not have a number of vendors, from soft drink companies to chips to snacks to greeting cards that are constantly in and out, but we still may have the copier guy that brings in toner, or maybe it's the office supply delivery or the coffee or what have you. So talk about perhaps some of the things that you guys were able to and certainly still implementing as it relates to vendor management and maybe trying to control access from that perspective.
Sure. So all of our vendors, before they walk into our buildings, there's a self-assessment that they should do, and we have it posted. Just like we said before, asking if you have any of the symptoms, have cared for anybody who is a positive COVID-19 patient, or been to or traveled to an area that's considered a hotspot. And then, that partnership that you have with your vendors, just making sure that you have an open communication. If you need to notify them of a positive case, and likewise, they need to notify you of a positive case, all while, of course, maintaining, HIPAA and not giving any personal health information out. And then being able to, investigate whether or not any of your employees came in close contact with that vendor and need to self-quarantine themselves.
And so I think that maybe gives us a good segue into Matt, and that is, as you start having conversations with, your insurance carriers and trying to just find out how you're covered and so forth, perhaps I guess maybe the first question is maybe simple as that, should business owners rely on their insurance policies for protection against claims and lawsuits that may ultimately derived from COVID-related illnesses?
That's a great question, and it really depends on the specifics of the policy and the specifics of the business. One thing that's been in the news a lot is business interruption insurance, and should that respond to COVID-19 related losses, financial losses that a business is incurring. And typically those policies aren't going to respond because there's not a covered cause of loss. There wasn't a fire or a tornado that damaged the building that's causing you to lose revenue. It is interesting from a workers' compensation standpoint. If, let's say, you have an employee that is, showing signs of COVID, and they decide to come to work anyway and try to hide it, and then they infect the whole office, well, is that something that's covered under a workers' compensation policy? And typically that's not covered. It would be the equivalent, Leonardo, of you having a head cold, showing up at the chamber office and getting some of the other chamber staff sick with your head cold. That is historically not covered under a workers' compensation policy. We are seeing an uptick right now in activity relating to employment practices, EPLI insurance, employment practices liability insurance. And that type of coverage responds to hiring, firing, discrimination, wage scale discrimination in the workplace. So I do see those policies responding probably more than you would see a workers' compensation or a standard commercial property policy responding. But the intent, of the insurance policies, they weren't designed to respond to a global pandemic of this magnitude. So while the industry is trying to figure out how we can best respond to this, I feel like the flurry of lawsuits coming in are going to continue until there's some sort of line drawn in the sand with a lot of the carriers and the public.
And so as a follow-up to that, then, what are some best practices that a business can implement to mitigate against claims and lawsuits?
Absolutely. So again, having a plan and sticking with it, as far as communicating to your employees what you're doing to protect them, following the CDC and the local, state guidelines with regards to the reopening, practicing social distancing, making sure that employees, know what the business is doing to keep them safe. And it's going to be different for a 5-person accounting firm than it would be for a restaurant, than it would be for a retail organization, than it would be for a gas station. So it's really, unfortunately, the onus is on the business owners and their management team to come up with that plan. But when you do, stick to it and encourage open communication with your employees. If you have something in place and you're following through with it, it's going to be a lot tougher for folks to come back and try to, file a lawsuit against you. Now, ultimately, at the end of the day, anyone can sue anyone for anything at any time. And I'm sure some ambulance chasers will start coming out of the woodwork for this. But if you are, clear in your communication to the employees and you're doing everything that a prudent person would do to best protect the interest of your employees, that's going to go a long way in kind of mitigating lawsuits or potential claims.
And so I think that's a good segue into you, Deborah. So Matt, you talked about, for instance, obviously having, the plans and understanding what your policies say and so forth. But certainly, Deborah, for someone such as yourself and even Kelly, you're working with leadership in terms of to communicate those plans and to communicate often with employees. And so this next question actually comes from the Q&A section, and that is, or the Q&A line, and that is, should we have documentation that, well, let me set, before I guess read the question in and of itself, pertains to employees coming back to work. And so in this case, should a business have documentation that they have officially invited employees back to work? And that they're asking this because there's concern about a staff member who refuses to work because they are anxious or afraid. How might they handle that situation?
So the answer, my answer to the question regarding should they have documentation is yes. The reason for that is, as Russell shared earlier, you want to be able to document and have employees sign off on the fact that they've received a plan to return to work, what's involved with that, what you're doing as an employer to protect them, et cetera. The important piece, I think, of this is to ensure that you are compliant from a perspective of what are the OSHA requirements as it relates to health and safety. All of this is a moving target. Every day things are changing. And so, we have to certainly keep up with that. But, CDC requirements, federal requirements, state requirements, et cetera. And so there might be an exception here but for the most part, an employee can't refuse to return to work if an employer is showing that they've done their homework and due diligence, to ensure that it's a reasonably safe work environment. Also, I think it's important to note that if an employer invites an employee back to work and they refuse to return to work and they are receiving unemployment, the employer can notify unemployment, and their unemployment benefits would possibly be ended. So those are important factors to consider. But I think the important thing here is that, many people are anxious and concerned and afraid in terms of coming back to work. I think there are a number of people that are concerned about, are we moving too fast? Are we, is it too soon to be coming back to work? So the employer is going to have to do some really, thorough work in terms of ensuring that employees feel comfortable with returning and understanding what the safeguards are and those kinds of things. But the answer is employees really can't refuse to return to work because there can be some potential repercussions in terms of them being able to get certain benefits and such in terms of unemployment and those kinds of things.
And I guess maybe as a tag along to that, and this would be for you, Russell, and I guess that is perhaps what can businesses actually, what can they mandate, or what can they tell employees to do? I mean, certainly they can say, okay, well, look, your hours are, I don't know, from 8:30 to 5 and we're Monday through Friday or what have you, but are there certain things that during this situation that employers can tell employees and legally?
Yes, and I think there's things that they should be telling them. So there's guidance from the CDC, from state agencies are promulgating guidance as well. I've seen in other states. I work at a law firm. I've seen the New York State Bar Association has a guide out for how to safely manage a law firm workplace. You can insert your own lawyer joke there if you'd like, but the answer is yes. So there's going to be all sorts of different workplace rules, and employers always have the right to enact workplace rules as long as they do it in a way that doesn't violate a host of employment laws that are out there. And you're not allowed to do it in a discriminatory way, whether for whatever protected class might be at issue. And as I think Deborah mentioned at the beginning, the ADA, which is the Americans with Disabilities Act, is probably most prominent right now because of this is a health crisis, and how that impacts people who have disabilities kind of comes to the fore. But I think as part of these policies, and kind of the way I conceptualize it is, there's a general policy that could go out right away, right? And it says things like, here's what to do if you're sick and have these symptoms. Here's what to do if someone you're in close contact with has tested positive or has symptoms. Here's the rules we're going to operate under. Here's the rules if you're in a remote working environment. Here are the rules for remote work. But then I think there's a second part to it that's going to be very fluid. And as Matt said, the situation is changing all around us, and we have to adapt our policies to that. So the part that I think is going to be fairly fluid, and you're even seeing it in the way Governor Hogan is kind of rolling out the reopening process, is as we go through the phases, different rules are going to be in place. And as employers that are supposed to be protecting our workplace, we have to adapt our rules, our processes to what that current guidance is and what's permitted. So a good example now is the order yesterday has limits on the amount of people that can be in retail establishments. and it has that 50% of maximum capacity limit. And I don't know what's coming for employers in an office context, but it wouldn't surprise me if some kind of similar percentage limit, capacity limit applied in other situations as well, as more businesses are allowed to reopen. And when that happens, you need a policy that says, you work on the A days, this other group works on the B days, or something along those lines. And by the same token, I think it makes sense to have, if you have two doors, an entry door and an exit door, to do all these things that reduce the risk. And my favorite example is, and this is pretty simple, but a lot of places have like the communal pretzel jar in the break room, which has always been kind of disgusting. But there's no reason to have that anymore. And frankly, there's no, maybe you should be taking chairs out of the break room because you don't want people congregating around a lunch table. You want people eating at their desks away from each other. So I think all those rules, those are all rules that employers can put in place in their workplace. And as they craft the detail of those rules, they really have to follow the CDC guidance, other government guidance, and then adapt that guidance to their specific workplace.
I guess that really changes what happens with the leftover bagels that you ordered from Giant when you've had your meetings in the morning. So another follow-up, but I'm going to also take a couple of things that came from the question and answer line. And so this first one was just, are there any sample policies for the written plan to share with employees, or is there any template of questions to answer in the business policy and resources and so forth? I would say one of the things that, and we just shared it this afternoon in our newsletter that went out, the U.S. Chamber has a phenomenal website dedicated to a host of these business concerns and issues. And one that they've just recently rolled out is kind of a return to work site or pages with various links and things of that nature. So certainly I would start there as one place. I would certainly say if you have maybe whether that's counsel, or if you have someone like, again, on the insurance side, or if you have an outsourced HR or even HR department starting there. I know that certainly, some of your truly, larger HR providers and PEOs are going to have some of these things that they would consult with you on. I'm sure, individuals like Deborah would sit down and talk with you. But certainly I would start with, like I said, maybe like a U.S. Chamber, probably NFIB, that's the National Federation of Independent Businesses. Also, I would even add as well, I think your trade groups would, because I know I've seen it on the restaurant side as well as the retail. They have a plethora of resources right now available for those that are trying to figure out what to do. The next question, Matt, this just goes back to you, and it was, I guess you mentioned an insurance, and there was a question as to exactly what was the insurance call that you referenced. I'm not sure if it was under the liability or workers' comp, but if you recall a specific insurance that you were.
I mentioned three. There's business interruption insurance, also referred to as business income insurance, workers' compensation, which everybody's pretty familiar with, and then it's called EPLI insurance, employment practices liability insurance.
And so I would say probably the first two people have some general familiarity with. Maybe just touch on what that last one is again, for just because I know I don't think that one is mentioned perhaps as often.
Sure. So employment practices liability insurance protects the employer or the organization against claims of discrimination in the workplace. So if you terminate an employee and they come back and file a lawsuit saying you let me go because I'm too young, too old, whatever, these policies oftentimes will respond to third-party discrimination. So one of your employees says something offensive to a customer and the customer tries to bring suit. Or if you have two employees that are performing the same job duty and one of the employees is compensated more than the other one, and there's an allegation of favoritism or sexism, whatever. So employment practices liability insurance as an insurance policy that defends against those types of claims and accusations.
Okay, thank you. And so this question goes back to Kelly, and it's from the Q&A, and it says, are there any exceptions, and this is referencing again when you invited people to come back to work, are there any exceptions, particularly if the employee is in a vulnerable population? And so, Kelly, certainly you guys deal with a wide range of age groups in the store. And so how have you handled that, particularly with your older workers and so forth?
Well, I think it was mentioned earlier, flexibility. You know, we're a very large organization, so we have the ability to be very flexible when it comes to a question like that, and really left it up to our employees to say if they weren't comfortable working, then they were able to self-quarantine.
Okay.
And I would just add that, you know, as you look at that as an employer, the important thing is to ensure that, you know, your practice, your plan does not have any it's not discriminatory in terms of the approach that you're taking to bring folks back to work. So if you have a high risk population, you know, that's certainly a group segment of the workforce that an employer needs to be concerned about. And so, you know, engaging in an interactive process, you know, just as Kelly has said, if you're in the position to allow them to work differently, those are considerations that, you know, I would encourage an employer to consider.
Okay. And so again, coming from our Q&A line, and this is perhaps maybe for you, Russell, first, and that is, so, and the question is, what if you have the ability and have successfully implemented a 100% remote workforce, and you start to invite employees back to work, and an employee refuses to return to work, and I'm thinking coming physically back to the office once invited, is there any recourse? And I think ultimately that, and again, I'm getting, I think from this, that they've been working remote, but now the employer wants them to come back to the office.
Yeah, so there's a you know, a lot of different levels to this. The first piece of this, you know, so if I got this call from a client, the first thing I would ask is, you know, what's the motivation to get back to an in-person workforce so quickly? You know, like I've seen it where a lot of workforces are able to work and function remotely, and forcing people back into the office, which, you know, all the guidance we see right now is if you can work remotely, continue to do so. But, you know, moving back to the office creates a whole bunch of different issues. This being one of them, another one being, we haven't really talked about it much on this chat, but the Families First Coronavirus Response Act that Congress passed provides for paid leave for a number of different categories. And, you know, I've seen it with a lot of clients where, you know, people aren't taking that leave because they're able to work from home and they're able to be flexible, but without schools and camps opening up, the second you require people to come back into the office, now you've got a problem where people are going to have to take the leave because they can't leave their kids home alone all day. So that's, you know, so I think there's a whole host of considerations that need to be made before you even make the decision to have a mandatory return to work. And, you know, you might even consider kind of having a transition period where returning to the office is voluntary, subject to a whole bunch of rules that we've already talked about, or, you know, could go into more detail on. But then, you know, once you get to that question of, okay, we're ready to return and require people to be back in the office, you know, one of the hallmarks of being an employer is that, you know, you can tell people when and where to work. And it's kind of the gig when you're an employer. But that being said, there's a whole bunch of laws that then protect employees. So, you know, as Kelly was saying earlier, if you do what you're supposed to do and the person isn't protected by any of these laws, I guess it was Deborah saying it earlier, you can require people to come back to the workplace, and if they don't come back, then, you know, they're disqualified from unemployment. And so there is some recourse. You do have some leverage there as an employer, but you have to be cognizant of the fact that when you do that, number one, you might chase your people away, which is not necessarily what you want to do, especially if you're functioning in a remote environment. And you also might take on some risks because, maybe the person raises what might be a disability concern under the ADA. Now you've got to accommodate that. And maybe that accommodation is remote work. So you end up back in the same place. So, I don't think there's a one size fits all answer for it, but I think there's a general set of considerations to consider before you go to that stage. And then once you're in that stage, when issues arise, you got to take them one at a time and be cautious about how you handle them.
And so I guess maybe another follow-up to that, I think through the CDC and so forth, we've heard kind of terms, and I even referenced it earlier in terms of vulnerable population. But is there also a definition, and this comes from the Q&A side, and that is what might be a high-risk employee? Either what does one consider to be a high-risk employee? Is that the same thing as vulnerable population? Is there a definition of a high-risk employee? If perhaps, Russell, if you could speak to that.
Yeah, well, so, I think you'd have to go kind of law by law, and they all have some variation of this. So for example, in Families First that I mentioned, that kind of defers that question to healthcare providers. So if healthcare providers write a note and say, hey, it's not safe, you need to stay at home or self-quarantine, then that's how we're defining that. And the CDC has its own definition of the vulnerable population. And then as we've mentioned the ADA a couple of times, if you fall into that a higher risk because of a disability, now you're protected by the ADA. So again, that's why this is so complicated and really a case by case question, because all these things are at play all the time, and you kind of have to sift through all of them to figure out which laws, or it might be one, it might be many, it might be none, but you got to figure out what you need to comply with in each situation.
Mm-hmm.
Yeah. Thank you, and so maybe this next question actually again kind of tags along to this theme, and for you, Deborah, if you could actually speak a little bit about the FFCRA, because there's a question here that speaks, I think, to something related to that and how that might be used. It says here, if an employee is not comfortable returning because their spouse is extremely high risk and they're nervous about bringing home the virus and exposing him, is there any resource for the employee as far as paid leave if theirs has been exhausted and they particularly have a job that does not allow for remote work? And so I know that there are, I think, three, within that FFCRA, I think there are like kind of three categories, in the sense that one, if you get 2 weeks, and then you can have up to 10 weeks. But if you could maybe go in a little bit more detail about that in terms of at times maybe who might be eligible for that program.
So an employee can, if the employee has been exposed to COVID-19, they can request employer paid leave. So the CARES Act provides for up to 12 weeks. So the first round is 2 weeks, and they are paid their full compensation during those 2 weeks, up to a maximum, and I don't have that number in front of me right at this moment. And then they can ask for an additional 10 weeks if, in fact, they need additional time for themselves, for a family member, or it could even be due to childcare. So to the point that Russell made earlier, it's important to really, consider, can an employee work remotely if that's possible, et cetera. And then, so those are kind of the main criteria as it relates to the CARES Act that an employer needs to consider around the paid leave. There's also paid sick leave that's a part of the CARES Act as well. And so an employer, I think it's through the end of this year, that an employee can use an additional 7 days of paid sick leave. So that's in addition to the up to 12 weeks of leave, which is similar essentially to the Family Medical Leaves Act. It essentially makes every employer covered and responsible for providing that kind of leave for their employees under the CARES Act.
Thank you. And so, let me just, and so with that, maybe shifting back to Matt on the insurance side. And so this, I guess maybe what are some questions that businesses should be asking their broker about their coverage now that we're starting to see things open up? And again, just kind of ensuring that they are, I guess, properly covered or at least understand the policies that they have.
Well, I think understanding the policies that you have is paramount, and any broker that's worth their salt should be able to clearly articulate that to their clients. But some of the coverages that we discussed earlier, employment practices, business interruption, if you don't have those coverages, it's something you should maybe start considering now. There's been an uptick in cyber attacks in the midst of all of this, with everybody using mobile devices and working from home. Well, we're going to continue to have our workforce, work remotely. Do we need to look into our cyber policies that we have right now? And just general risk management. What are we doing to try to mitigate any losses that we may be perceptible to? Do you have adequate, PPE in place for the employees? Are you outlining, policies and procedures for your employees, for your clients, for your vendors? But talking with your broker about what you have, what you don't have, and what you may need as things slowly start to reopen.
And so, Matt, while we have you, this next question actually from the Q&A actually kind of speaks to on the facility side, and I will share with the group our next webinar like this, which will be on the 19th. Actually will really dive into facilities management. So certainly if you have specific questions about buildings and about things you can put in place in your offices and health facilities and so forth, certainly invite you to come back there. But this question says, this person rents their facility to a large private, they said, I rent my facility to large private social rentals like weddings. Mm-hmm. How much responsibility can they place on the renter? And what is the liability as the facility management owner, /owner for guests that attend a rental event related to COVID? So I think if you got the question.
Sure, and I'm going to pivot. I'll give my quick response, and then I'll pivot to Russell a little bit on this. But it's a lot of the devil is going to be in the details within the rental agreement. For that, is there a waiver of subrogation and a hold harmless agreement where the party renting the facility agrees to hold the host harmless if something were to happen? Because a lot of that language is already found in those contracts. Or you're going to need to provide your own evidence of insurance, because if grandma slips and falls on the dance floor because she had one too many glasses of champagne, we don't want that to fall back on the host's insurance policy. So take a look at the contracts with that and see, what sort of language is included in there to shift some of those responsibilities. Does that sound accurate, Russell?
Yeah, no, you can be a lawyer. You did it right. Yeah, we always just say, look at the documents. But yeah, and that's something if if you have that specific concern, that's your business. You might want to sit down with a lawyer and kind of work through your documents and figure out exactly what you need and compare it to what you already have insurance for and make sure you're as protected as possible.
And so with that, I'm going to shift back to Deborah for a second, on this return to work deal. And that is, Howard County particularly has a lot of government contractors. And for some of them, they have been working throughout, and particularly some have to be on site. And so you work a lot with government contractors. You're actually a government contractor yourself. Mm-hmm. And so perhaps if you could share, what can government contractors specifically do to maybe minimize their exposure and protect their employees, particularly when they have to be on site per the contract?
Okay, so before I answer that, if I could go back for just a quick second on the CARES Act. Yeah. I just wanted to mention that there is an employer poster that is on the Department of Labor website. And if you can't find it and want to reach out to me, you can do so and I'll send it to you. But it's very easy, very clear to understand in terms of what the CARES covers and what employers are supposed to do as it relates to employer paid leave and paid sick leave and those kinds of things. And also, if you haven't done it, that poster is supposed to be provided to your employees. So if your employees are working remotely, it needs to be emailed to them or mailed to them. If they're working on site, of course, you can have it in a general location where employees would be able to view it. So just want to mention that as well. In terms of government contracting, one of the things that we haven't seen a whole lot of in the news is that the fact that there's still a number, many federal employees that are working at government locations, and they have been working throughout COVID-19. And in a article that was published earlier in the week, it indicated that there are more than 10,000 federal government employees that have been tested positive for COVID-19. And so there are people that are quarantined and, having challenges associated with this because the government couldn't actually shut down in many cases. And so something that's important if you're a government contractor is to ensure that you have a conversation with your contracting officer and with your contracting officer representative regarding how your employees are going to be handled in that setting. For example, one of our clients is the U.S. Department of Homeland Security. We have a new staff member that's starting next week. And so we're trying to get clarity from them regarding, what's the protective equipment that they need to have coming on site. Are they going to be working remotely some of the time or on site some of the time or 100% remote? We're trying to get clarity around that because we, the employer, are still responsible for that employee, and the government isn't necessarily going to share that or doesn't want to share the employer relationship. So it's important to get really clear with your customers, your federal customers around these issues. Talk with the contracting officer about the contract, what modifications might need to be made to handle these kinds of things. I know that we certainly are talking with contracting officers about the payroll taxes as it relates to PPP and other matters. So this is a good time to have those conversations and get clarity around that. And what I also think is really important is staying close to your employees, staying in regular contact with them, understanding, what's working well, if they have any concerns, and working to mitigate those concerns because, a plan is only as good as you work it, right? So you want to ensure that, you have a good action plan, you have a way of understanding from your employees' perspective what's going on, and you're proactively addressing concerns so that there is a limited or no opportunity for any kind of negligence on the employer side. Excellent,
thank you. Well, we're getting close to being running out of time, but do have just a couple of quick questions, one for Kelly that I think also kind of stems from the chat room as well. And that is, all of you actually have talked about having a plan, a document that you can share with employees and so forth. And I guess the question ultimately is kind of maybe who prepares the plan or how is it prepared and who reviews it? And so, Kelly, I'm going to ask you that just because Giant is such a large entity with such a, diverse set of employees, if you could maybe just share a little bit about how that document was put together and so forth. Or if you, if it came from legal, if it came more out of risk management, but I think that's where the question is trying to figure out where do they get started.
Well, I can say that certainly the CDC has a ton of information around, how, I guess, the science and the information that you would need to be able to set something like that up. And yeah, I'm sorry, it was a partnership between, legal, risk management, quality assurance. A lot of people contributed.
So I think that, but if nothing else, that gives an example of kind of some of the players that needs to be involved, that it's not just one shop in the sense of, in this case, that there are a lot of different perspectives that need to come into play. And so as we prepare to wrap up, this last question, I'm just going to quickly run through all of you. So yes, or better yet, I'll just ask who wants to weigh in on it. So yesterday we had a town hall with Congressman Sarbanes, and one of the big things that's being discussed right now in Washington is on business liability. And so, and ultimately kind of between business rights, employer rights, what have you. Any, from those of you that have followed the debate, just as we close, perhaps any comments that you want to share on the legislation that's being, or I don't even want to know if I want to call it proposed legislation, but maybe on the concepts that's being explored.
Well, I can weigh in on that a little bit because as you know, we followed the Families First Act, we followed the CARES Act, and if I've learned anything from those two laws getting pushed through, it's to not rush to any conclusions about what the law actually means, how it's going to actually impact anyone, because they wound their way through the legislative process, and then various agencies have interpreted them in ways that maybe aren't obvious from the text of the laws themselves. So, I certainly understand, the discussion and the idea is that if we're going to reopen and we're going to not be afraid to reopen, that we need to protect businesses so that they're not exposed when they start doing business again. And, that would be great, but at least for businesses anyway, but it exposes a lot of individuals. So at least what I've seen kind of in a very preliminary state is that any kind of limit on liability is going to be paired with meeting certain thresholds and engaging in certain practices to keep customers, employees safe in the workplace, which, kind of makes sense. You shouldn't be immune if you're not, and then be left to do whatever you want. It should be tied to meeting at least certain minimum thresholds. So, in my mind, it's not so much immunity as it is setting the baseline threshold to avoid liability.
Yeah, and what I would just add to that is that, we're all in this together, and we're learning. This is something that none of us have ever seen before. And so it's, it's a moving target. And so even those regulatory agencies like the Equal Employment Opportunity Commission and the Department of Labor, they're learning too. I mean, I'm in contact with points of contact at those agencies, and they don't have all the answers yet either. So information is fluid, and it's constantly coming forward. So as I think Matt said earlier, being flexible is really important, and then just staying abreast of what's going on, I think, is key.
Excellent. Well, with that, I want to thank all of our panelists for participating this afternoon and sharing your insights. I think certainly by the questions posed, there's a lot of thoughts that are weighing on employers and managers' minds. But again, hopefully you guys found this helpful. Again, we'll be back next week or next Tuesday, and we'll be talking about facilities management. And then on Thursday of next week, we'll talk about behavioral and mental health. Because I think, again, we're seeing a lot of some of these questions also are certainly going to be impacted by the mental state in which employees come back to the workplace. And so, again, thank you all for joining us, and we'll see you next week. And thank you, Deborah, Kelly, Matt, and Russell.
You're welcome.
Thanks, everyone.
Yeah.
Bye-bye.
Thanks for having me.